let's talk about the annual physical. For a lot of us, just hearing those words can bring on a little bit of anxiety, right? What are they going to find? What's really going on behind that closed door? Well, today, we're going to pull back the curtain and demystify the entire process so you can walk into your next appointment feeling way more confident.
And hi, if you're kind of nodding your head right now, you are definitely not alone. It is completely normal to feel a bit nervous about a doctor's visit, especially if it's been a little while. But you know what they say, knowledge is power, and that's exactly what we're here to give you. So, to help put you at ease, we're going to take a virtual tour of a typical annual physical. We'll go through it all, from the moment you walk in the door to that final chat with your doctor. Sound good? Let's get started. So, first things first. You might be wondering, why should I even go if I feel perfectly fine? Well, think of it this way. Modern medicine isn't just about treating you when you're sick. It's about preventing sickness in the first place. And this appointment, it's one of the most powerful preventative tools you have in your toolkit. This exam really has a few key goals. It's your big chance to build a real relationship with your doctor, so they become a true partner in your health. It's also dedicated time to go over your medical history and bring up anything new, even if it seems small. And, so importantly, it's where you learn about the specific health screenings that are recommended just for you, based on your age and lifestyle. Okay, so you're in the exam room. The very first thing that almost always happens is getting your vitals checked. This is the routine, totally non-invasive part that gives your provider a quick snapshot of how your body's most basic functions are doing. Yep, these are the big five on your body's own personal dashboard. Take blood pressure, for example. That top number, that's the pressure in your arteries when your heart beats. The bottom number is the pressure when your heart rests between beats. Each one of these five measurements is just a vital piece of the puzzle, telling the story of how your internal systems are running right in that moment. And this brings us to a really crucial idea, a baseline. The first time all these vitals get recorded, they create your personal health snapshot. Think of it as the you on a totally normal day. Every single future exam will compare your results back to this baseline. It's how doctors spot any important changes, track trends over time, and figure out what might need a closer look. Along with those vitals, they'll also check your height and weight. That's part of the baseline too. And then they'll pull out the stethoscope to have a good listen to your heart and lungs, just making sure there aren't any unusual rhythms or sounds. It's all part of building that complete picture of your health. Okay, on to the next phase. After all those external checks, it's time to get a sense of what's happening on the inside. This usually involves a blood draw, and something else you might not even notice is happening, a continuous visual exam.
It's honestly amazing how much information a simple blood draw can give. Your provider can check for common things like low vitamin D, which can make you feel tired. They can also see key indicators of how well your liver and kidneys are working and look for markers that might explain any specific symptoms you've been having.
Now, this is such an important point. From the very second your doctor lays eyes on you, the exam has already begun. The entire time you're talking, they're not just listening, they're making crucial observations. They're noticing things like the condition of your skin, how you walk across the room, the clarity of your speech, even your memory, and how quickly you answer questions. These visual cues can signal everything from excellent health to potential underlying issues that need looking into. All right, next up is the part that can sometimes cause a little bit of anxiety, the physical, hands-on part of the exam. So let's just break down exactly what the provider is doing and maybe more importantly, why they're doing it.
You might hear your doctor use the word palpate. It sounds pretty technical, right? But it simply means to examine by touch. That's it. Your doctor will use their hands to gently press on different parts of your body, usually your abdomen, to feel for anything that seems out of the ordinary.
So what are they actually looking for? Well, by pressing on your abdomen, they're checking for things like fluid or tenderness around your organs. That little tap on the knee, it's not just for fun, it's a real test of your neurological reflexes. They'll also feel your joints for any signs of inflammation and might even do a quick test of your muscle strength. It's just a hands-on way to check in with your body's systems.
Okay, now we're going to shift gears from assessment to prevention. A huge, huge part of the annual physical is planning for your future health. This is where you'll talk about screenings and make sure all your vaccinations are up to date. And I really can't overstate this. Proactive health screenings are one of the most powerful tools we have in our arsenal. Catching something in its earliest stages can completely change the outcome, turning what could be a serious diagnosis into something much more manageable. Just look at this powerful example. The 5-year survival rate for prostate cancer is nearly 100% when it's caught early through screening. I mean, that's incredible. This is a perfect illustration of why these conversations during your physical can be quite literally life-saving.
You know, we often think of vaccinations as something just for kids, but they are so important for adults too. Your physical is the perfect time to review whether you're due for things like a flu shot or vaccines for pneumonia or shingles, all depending on your age and unique health history. So, when you put it all together, the vitals, the blood work, the hands-on exam, the preventative planning, it all becomes so clear. The annual physical isn't something to be afraid of. It's an act of empowerment. It's you taking a powerful, positive step for your own long-term well-being. By now, I hope the whole process feels a lot more manageable and a lot less mysterious. Your health is a journey, and your doctor is really your co-pilot. Scheduling that appointment isn't just checking a box. It's the first and most important step you can take to become an active partner in your own health.